I'm a teacher and a cheerleader coach. When I was walking from my classroom to the gym or to the cafeteria, then I noticed I would be completely out of breath. I would just have to stop teaching, stop, talking with my girls in the gym till I could get my breath. I'm Beth James. I'm a patient of Dr. Kaufman. In mid-July of 2017, I had a routine shoulder surgery. It was to repair a rotator cuff. And when the anesthesiologist was giving me the block for my arm, my phrenic nerve was damaged. I really didn't know that I had a problem until a few days later. When I got up and started moving around, I noticed that I could not breathe. I could not get a deep breath. And so it left me feeling upset. I went back to my orthopedic doctor for my checkup, and I told him, I said, I'm having trouble breathing. And he said, well, let me send you to a friend of mine who's a pulmonologist, and we'll see what he says. And so he did, and he ran some tests. And so I was just frustrated. That's how I came to start looking for somebody to help me. I Googled phrenic nerve repair, and I found an article. I read the article, and it gave me so much hope. And so I contacted Dr. Kaufman's office, and the staff were so kind and so helpful. They just went above and beyond. And they told me to send all of my test results, that they would let Dr. Kaufman look over them. He would look over them and call me back and let me know if I was a candidate for the phrenic nerve repair. And one day the phone rang and it had New Jersey. And I thought, oh, maybe this is it. Maybe this is it. And it was Dr. Kaufman himself calling me. I mean, it wasn't anybody from his office. And that spoke a lot to me. He told me I was a candidate for the surgery, and that he asked me, would I be willing to go through with it? And I was like, yes, sign me up. I want to do it. Dr. Kaufman, when I met with him, he was telling me about the surgery. He told me that he was going to open my neck up and look at the phrenic nerve, find the damaged area. He would take a nerve from the back of my leg or the back of my calf and put it into my neck and reroute around the damaged area. I felt better the next day. I could breathe better. I felt really good. I felt the surgery was a success. And I was getting back to doing what I'd always done. I was teaching, I was feeling better. My girls won a state championship in cheerleading. It was so wonderful just to be back to normal. In August of 2020, I started feeling, I lost my taste and smell. And that was my first indication that I might have COVID. I ended up staying the whole month of September in the hospital. 12 of those days I was on the ventilator. They told me that there were doubts that I would make it. When I came off the vent, I had to stay for physical, speech, and occupational therapy. I was afraid I would not get back to where I was before COVID because, like I said, with the surgery with Dr. Kaufman, I was back to my normal. I was back to my normal after my surgery. After COVID, I had to go through all that therapy again. But I remember something that Dr. Kaufman told me. He said, you need to be patient. And I feel like I'm on my way back. But I credit Dr. Kaufman for getting me through COVID, because had he not performed the phrenic nerve repair on me, then I would not have been well enough to have fought off COVID. So I give God credit first. And second, I give Dr. Matthew Kaufman credit. My advice to someone who is considering the phrenic nerve repair surgery is to do it. I know without a doubt, if I had not had this surgery, as I said, I would not have survived COVID. It's life-changing. It was for me.